What treatment options are available in our country?
So, do you mean recommended ones or?
Yes, I think recommended. Yes.
I guess it depends on what the issue is.
Okay.
So if you're going through stress, maybe some relationship problems, some financial problems, and so on, you can even see a counselor. So sometimes it's a counselor from church, sometimes it's a counselor from the community, and so on. And if the problem is bigger than that, then you then need to move to either see a psychotherapist or a psychologist, really, a clinical psychologist.
Okay.
Yeah, so they'll be able to give you psychological techniques that you can use to then deal with your mental health and so on. And if the psychological techniques on their own are not adequate, or if a person is so severe they actually need medication, then they need to see a psychiatrist.
Okay.
So that medication can be prescribed and maybe the person can get back to psychotherapy in order for them to, or both of them actually sometimes would have to take place at the same time to accelerate the process of healing.
Okay. You're talking about seeing a psychiatrist, the psychologist, clinical, but where are these people from? Are they in Zambia? I promise you, I've never heard of, I think I've heard of one, but other than that, I haven't, like, apart from you.
Okay, so we'll start with the very basic ones.
Okay.
The government. So when you go to government clinics and so on, you have, I think you have psychosocial counselors.
Oh, you do?
In clinics,
Okay.
yes. They're at least able to counsel you for if you want to do an HIV test or after you get your results and so on. If you want to discuss family planning, you want to discuss a few problems. I think now the curriculum has changed to include more than just HIV and reproductive health. So they're able to give you some coping techniques and so on and so forth. Then when you move from the clinics, then you have hospitals like UTH and Chainama. I think also Ndola Central, where they actually have a clinic, which is a psychiatric clinic or a mental health clinic. And in those places, especially I know UTH and Chainama, I'm not sure about Ndola, they even have people who've done psychology who actually do cognitive behavioral therapy and some kind of therapy for the clients as well. So apart from, if they need medication, they go ahead and get medication. If they don't, they just see the psychotherapist and so on. So you have those services in the government. In the private practice, that's one of the things that we do.
Yes.
Yeah, we do counseling, psychotherapy, coaching and training and so on, and we also do psychiatry. Apart from us, there are also other private practitioners. I don't know if you've heard about M&K Psychotherapy.
No. Are they in Lusaka?
Yes, they are in Lusaka. There's also Silver Lining. I think that one is primarily a psychiatric clinic. And then there's also Psych Health. Psych Health also does psychotherapy. Then there's an organization called Mulenga Autism Foundation. Okay, so the primary focus is autism, but they also offer some support and psychotherapy to families that may be experiencing some distress during that time. On the Copper Belt, I've forgotten the name of the place, but there is one in Kitwe, a practice, and there's also another one in Ndola. And then there are a number of freelance psychologists and psychotherapists as well.
I was about to
professional ones,
like the ones we see in movies, those where you just go see them.
Yes, something like that. Yes, we have a few of them. But yes, I must admit that it's a space that is not well developed in Zambia, and I'm not surprised that you don't know too many people in that space.
Yeah. Okay, that's cool. Now you've mentioned all these companies and government places, but are they affordable for the typical Mwape and Mwansa who are struggling with mental health? How affordable are they? Is it like, if I'm just a girl, not little, but you know what I mean, like the typical Zambian, can we afford to go to these places?
I guess it depends on what you want.
Okay.
So there are some services that are available that you can afford. You want to pay?
So if I want to see a therapist, is it per hour? Do you pay
Yes,
per hour?
yes, you pay per
Okay.
hour.
And what's the typical range?
I'll quote in dollars because I think it's just easier for me to quote in dollars.
Really?
Not necessarily that's how it's priced.
I was about to ask.
But I'll quote in dollars.
Okay.
I think the range is generally from $25 to $100
Per hour. Ooh. So what happens to those who can't afford that?
There is government. There is.
But is the
CTH,
service, this is a
there
very
is-
good question, is the service as good in the government as it is from the private, like institutions and companies, or?
I don't think that's a very fair question because when we consider just why do we have private hospitals when we have government hospitals?
I get you.
Yeah. So I would just leave it at that.
It's a tricky one for you too. Okay. Do you foresee a time coming in the near future where the government or non-profit start institutions that provide mental health services, purely mental health services, under the impression that Chainama doesn't cater for mental illnesses that are on the lower spectrum?
Okay, so by lower you mean like mild
And moderate.
Okay. So I think they're already doing that.
Okay.
Not just the government, but also some non-governmental or not-for-profit organizations. I mean, Chainama has been one of the longest serving providers of mental health. I think the issue around that is that there's been a lot of stigma because a lot of people wait until the situation is very bad before they can take people to Chainama. And so as a result of that, you end up having a lot of severe cases there.
Chainama.
And then people think, oh, only when you're very severe can you go there. But there is an outpatient department where you can actually walk in and get treatment as an outpatient, even at UTH. There's that as well.
Okay. And is there room for mental health in Christianity? You hear some Christians in our culture tell you to seek Christ when you talk about struggling with mental health. So does seeking therapy or counseling mean you're implying Christ is not enough?
Well, I certainly think that there is a huge role. I think one of the things that we see in Scripture, I'm getting tempted to say, like I said earlier.
It's just a disclaimer. I'm so sorry. So we're recording and she did so amazing. And then the camera, like things happen. So she's basically trying to repeat what she said. So, yeah. Okay.
Yes, so the Bible does talk about the Holy Spirit as being the wonderful counselor. So we see God himself being a counselor. And we see various examples of how God reaches out and ministers to us people. But apart from that, we also see different examples of people in the Bible who experienced mental health problems. We see Nebuchadnezzar, who got to a point where he totally lost his mind. We see David, who had anxiety problems. He couldn't sleep, he couldn't eat, his bones were in terror all the time. And we see people who were also depressed. I mean, David himself was depressed. We see people who got to a point of being suicidal. Earlier we talked about Jonah. And Moses himself, he telling God how he would rather die than see certain things happen in life, and he was just like, I'm ready, just take me. So we see different examples of people who actually experience mental health problems in the Bible. And there's definitely a role for Christianity in mental health, and those two can both happen.
You talked about how the brain should be treated the same way the body is. Do you remember that?
Okay,
Yeah,
so one of the
medication.
things I think you asked me was, can we just pray for mental health problems
Yes.
to go away? And one of the things I said is, can we pray for other physical illnesses to go away? And I think you said yes. So in the same way that we can pray for physical illnesses to heal, we can also pray for mental illnesses to heal. But also, I think one of the things we talked about is how that we can also believe that God can use medication to heal someone. And if we're going to believe that, I think we should be consistent enough to believe that God can also use medication to treat mental health disorders.
Okay. How can our country practically spread mental health awareness as a whole and as individuals, aside from videos like this?
So, yeah, we need to have more conversations about this, more and more conversations. I think one of the examples I like to look at is HIV. When it started off, it was something that was hidden, nobody spoke about it, and nobody could explain what was going on. But now, because of so much conversation about it, you have clinics offering these services, which are just convenient for everyone in every area. And I think if we continue having these conversations and talking about it, we will get to a place where every clinic is also able to provide mental health services in the same way. And people are able to recognize that, look, I can experience a mental illness just as well as anybody else. Or there's been mental illnesses in my family. There's, trauma that people have experienced in one way or the other that have led to this. There's an alcohol problem somewhere. There's a marital problem that has led to someone being depressed. And then we can be able to provide all these services around that can really help somebody instead of having to travel all the way to Lusaka to get the service.
What do I do if I know someone who appears to have the signs of one struggling with their mental health? And more importantly, what do you not do? Which is in line with one of the questions that came in. If a friend is suicidal and asks for help, what would be the best possible advice?
The most important thing is to be available. Just be available and talk to them. I mean, if you are close enough, you can actually talk about the issue, that I think you're going through this and I think you need support, and recommend them to either get support from a professional or a counselor who's available, and so on. And that's the most important thing. I think one of the things that you should not do is try to belittle the threat, or try to say, you're just trying to seek attention, this is nothing, and so on. In the past, we have seen people who were trying to get attention actually accidentally die by suicide in the process of trying to get attention. So every threat on someone's life should be taken seriously. And even if a person is trying to get attention, I think one of the questions you need to ask is why. There's a problem there. Why are they trying to get attention? Then there must be an issue.
Are there any coping mechanisms for anxiety?
There are several, and a number of them we teach during psychotherapy. And some of them include things like graded exposure and also relaxation techniques that a person can learn, cognitive behavioral therapy. Some therapists also use hypnosis. And sometimes you have to medicate people because maybe their anxiety, the techniques, they're not able to help with anxiety. So you may be able to give medication to actually help out with those things.
And just a quick one too, when you talk about medication for anxiety, do we actually have medication for mental illnesses in Zambia?
Yes, we do.
For both mild, moderate, and high? Is that
so? For mild and moderate mental health problems, the treatment is usually psychotherapy.
I see. Okay.
And then for moderate to severe, it's medium, moderate to severe. Then you add medication.
Okay, and we actually have.
Yes, we do have medication in Zambia.
Okay. Why do men tend to have difficulties talking about their problems? I know according to statistics, men have a higher suicide rate than females do. So any special word for the men out there?
Well,
as I said earlier,
I will not say that since you have said it. One of the things that I like to look at is the example of Jesus Christ. and Jesus Christ himself was vulnerable enough to talk about how he was hurting, how he didn't want to be alone. I mean, at the hour of death, he told his friends, please stay up with me, you know. We see Jesus crying and so on. But we also see him having deep relationships to the extent he was able to tell his disciples, I no longer call you servants, but I call you my friends because I've told you everything that I am about. So he was able to open up and share who he was, and who are we not to get that support? So I think that men need to get that support as well. They need to open up, they need to reach out and get the help. And we need strong men in society, and strong men do not come from hiding hurts and vulnerabilities and carrying extra burdens. They come from being open and experiencing true healing.
That's true. How can Black parents be educated on the fact that depression or anxiety is real?
Okay, are you about to illustrate that?
Yes. Oh, so basically, if I'm struggling with depression, so I'm at school, depression is taking a toll on me, and I'm trying to explain to them that I'm not in a good place mentally. But then I think an example maybe people will relate to it, when you talk to your parents about it, they may, just work hard. We all go through. Life is hard. They love life. They're actually like, oh, life is hard. Life's like that sometimes. So how can you let them know that what I'm struggling with is actually quite serious? It's not something that should be watered down.
So I guess one of the things is having conversations with them, just being able to talk about them and try and address it. But if even that is a problem, possibly talking to someone else outside the family, an auntie or an uncle who you can then ask to either speak to them or sit with as you speak to them about the problem, so that they can understand how serious the issue is. And hopefully you will not get a spanking after they're gone for having done that.
Okay. And then how do you overcome being depressed about how you look and talk in order to become more confident?
Okay, so even that is dependent on what the issues are. Like, why is the person depressed about how they look and talk? Is it that they had a previous experience which needs to be explored? Do they actually talk funny? Maybe they do have some problem, like stammering, or their voice has a squeak or something that they need to deal with, and so on. Or do they just have other insecurities that are now manifesting in the area of how they look and talk in public? So those issues need to be explored and find out exactly what they're dealing with in order to be able to help the person to be more confident.
Okay. And is feeling low a sign of depression?
Not today.
Not today?
Like, not just today.
Okay.
So so you can't say you feel low today and then it's a sign of depression. You should have been feeling low for over 7 days minimum, and even then it should be a significantly low feeling that it disrupts your day-to-day activity. Like, it should disrupt your concentration, your appetite, your sleep, your motivation, and so on. So it can't just be just feeling low. It has to be feeling low and then other symptoms as well. Then we can say, okay, this person is depressed.
And then I had one more question.
Yes.
Okay. How can we differentiate between moodiness and bipolar? Anxiety and lack of trust in God, depression and sadness? I personally think there's a very thin line between the two, but you have more knowledge, so maybe you can shed more light on that.
Okay, so I think one of the things about moodiness is, for you to say somebody is bipolar, then they have to show that attribute in more than one area. So you can't just say they're just bipolar with their mother and then you say they're bipolar, because they may just have a bad relationship with their mother. So whatever symptoms you're seeing should show up at more than one aspect of their life, in their marriage, at home, in their workplace, in their social life or recreation. Then we'll be able to say that there is a problem there. And it has to be significant enough to actually disrupt their activity. So if they just have minor problems relating with people, then you can't really say that that person has got a disorder. Yes.
Okay. And then anxiety, lack of trust?
I don't know if they're related. What do you mean?
Lack of trust in God and anxiety.
Okay. So I think that lack of trust in anxiety is just basically having this persistent fear.
Okay.
Yeah. The lack of trust in God doesn't necessarily mean that a person has or does not have fear. I don't know if it makes sense. So I think they're kind of independent, but they can show up together. So if I'm really afraid, does that necessarily mean that I don't trust God?
Doesn't it?
I think that when Peter stepped out to walk on water, he was afraid.
Oh, I see.
But
okay.
he still stepped out to
I
walk
see.
on water
Okay.
and so on. So feeling the fear is not necessarily the same as having. I mean, I'm thinking about Gideon. Gideon was terribly afraid, but he still trusted
Okay,
in God
I
enough
see.
to go. Even when he was doing whatever he was doing, he was terribly afraid. But I think the anxiety comes in when it cripples you. Like a
Okay.
person can't even function because of the anxiety. It prevents them from doing things. They can't get out. They can't live life. They can't do those things. So I think
I
that
see.
there is a difference there.
Depression and sadness?
So like I said earlier about depression.
Long period of time.
Yes. So
Okay.
if your person is feeling sad, it has to be a very deep sadness where the person is crying, find themselves like maybe they're not necessarily crying, but they can't feel happiness. They can't enjoy things. And it should be persistent, and it should be over a period of time, and it should not be just sadness.
Okay.
There's going to be other things as well, appetite or sleep affected.
I
and
see.
so on.
And then hair. I'm also going to bring hair in. Do you think, I've noticed when something bad happens to someone or when they go through something that kind of affects their mental health, we are so quick to, it's the hair that suffers first. From my own point of view, I don't know if you've thought of it. I feel like, okay, if I go through a breakup, first thing that I need to cut my hair, I need a new start. If I do this, it's like, no, I need to change. I feel like hair, is there a relation between hair and mental health? Or is it just the easiest thing to attack when things are going south?
Studies have shown that for people who are in hospital, when a beautician, what do you call the people who do hair?
That's very awkward. I should know. Hairdresser?
Yes.
Okay.
When hairdressers went and combed hair and did hair for clients, it
Okay.
actually elevated their mood.
Oh.
Yes. So there is an association between something that's a part of you being taken care of
I
and how you
see.
feel. With some people, it can be just being able to take care of your feet or your hands or something, but there is an association because it's a part of you. So sometimes it's feeling like I shouldn't care for myself at all. And
Yes,
I don't even
I was
want
about to say that's
out there.
another
For
one.
others, it's like, oh my gosh, I'm so going to overcompensate.
I
So
see.
they've dyed their hair
I
and changed their
see.
hairdo and done something that's really remarkable because they're just trying to defy some low moments in their lives.
So there is. That's interesting. Okay, thank you so much for coming. And the name of your, I don't know how to say the name of your, is it a company, a business, an institution? Company?
practice.
Practice. The name of your practice, Renaissance?
Yes.
Okay, so they have a Facebook page that you can check out. Your offices are in Woodlands. Are they still in Woodlands?
Yes.
And all the details are there if you'd like to see someone. She's really, like, for real, when I think of mental health, to be honest, when I think of mental health in Zambia, I only think of you. So I didn't even know there are other people out there who do things. And she has a Facebook page, just Maria Akani, right?
Yes.
And she has some workshops. She recently had one at Cresta Golfview where they're talking about mental health issues and awareness. So please check it out. But thank you so much for sparing time to visit my channel. And hopefully we shall see you soon.
Thank you for having me.